start?
I'm ready.
Dan? I want to welcome you to the Affordable Care Act Educational Forum. The purpose of tonight's meeting is to bring together knowledgeable community leaders who will provide you with information and answer any questions you have. The speakers would like for you to ask questions as they come up rather than waiting until the end of the meeting. We'll have a short follow-up at the very end of the meeting. So when you ask the questions, if you could speak up so that everybody can hear the question and everybody can benefit from your question. Our first speaker is John Miner from the law firm of Miner, Bell, and Neal. John is an expert on the Affordable Care Act and has been actively educating the business community on what the law means to them. Tonight, he will provide expertise on what the law means to you as an individual, a family, or small business. John is a graduate of Vanderbilt University and Mercer Law School, and we are honored to have him as our first speaker. He's going to be going this way.
Maybe I'll stand over.
So you're going to be standing up there?
I'll do that. That way I can. I've got a slideshow here, and I'm sorry to make y'all do the gymnastics, but you know, we're in the community center, so maybe we can get a little exercise. How many? You know, I don't know what experience everybody has with Obamacare, the Affordable Care Act. I guess I might want to take a little poll if people could raise their hand. Who here knows nothing about it?
No, you're fine.
Maybe other than what you've heard on the news. And then who has questions for me tonight? I bet you already know what the questions are going to be. Okay. All right. Well, that gives me an idea of what my target audience is. I'm going to give you an overview. This is just, like I said, I've got a slideshow. I think it's going to be useful because we need a lot of numbers and fun things like that. But this isn't a political presentation. I wanted to put that out there too. It's intended to not be a mudslinging contest or anything like that. Obviously, it's a hot button issue, but it's what we have now, and that's where we are. So I'm not trying to take a side one way or the other, and I hope y'all will agree that that's not going to be of much use for where we are today. So, without further ado, I want to start with a little bit of a history, remind you of how we got where we are today. You'll recall that President Obama, when he was becoming elected, the biggest thing on his platform was health care. He thought it was very important to reform our health care system. So he pushed this, and if you go all the way back to 2008, 2009, when he was elected, that's what it came to. And the reason for that was due to a number of issues, but the biggest thing is health care expenses. Our health care expenses are clearly going up, and it's been evident for a long time that they're sort of skyrocketing out of control. And I think everybody agreed with that. I think both sides of the political discourse at that point agreed that health care there needs to be something changed. Obviously, there was a difference on what that something was, but the healthcare in the United States is sort of a two-payer system. We've got health insurance who pays a lot of your bill, and you pay the rest of it. You kind of split the cost, right? And so that's inherently a little bit different from other countries, and it makes the payment process tricky, for lack of a better word. So cost of healthcare, cost of health insurance in particular, was a hot-button issue, and really sort of the main staple and reason for the bill. And we came to a point, obviously, the law finally passed. We had a Supreme Court decision that upheld the law, and we are where we are today. Now, I wanted to remind everybody, too, the initial goals when the president was running as to what the act was intended to do. And I don't know whether it covers all these goals, but it definitely covers some of them. He wanted to reduce healthcare costs, reduce debt and bankruptcies due to healthcare costs, guarantee that you could keep your doctor, keep your choice of doctors, invest in prevention and wellness, make sure we could cover these problems on the front end, and end barriers for pre-existing conditions. So I think the current law does some of that. Again, it was passed in 2010, March 23rd, and the Supreme Court recently upheld it in 2012, June 28, 2012. That's a little bit of the history of it. I just thought it would be helpful to go through that. Let's talk about what the law does, okay? These are sort of some of the main things, and we're going to cover most of these in one form or another. But basically, because if you go back to that original goal of it, which is to reduce healthcare expenses for people, and the cost we pay for healthcare in this country and health insurance companies, that's one thing that it's intended to do. But in order to do that, it offers a competitive marketplace, these exchanges that we're going to talk about. We're going to actually see some of that in action later tonight. These health insurance exchanges, also called marketplaces, where you can buy health insurance. Whether or not your employer offers health insurance, you can buy health insurance through this exchange. It's sort of like going to a strip mall or something where theoretically, you've got a lot of different health insurance plans and providers that you can compare in one place, rather than having to compare things, ad nauseum. So it sort of evens the playing field, and also it tries to sort of compare apples to apples with the health plans that are in the exchanges. So every plan under the exchange, excuse me, every plan is supposed to cover similar things. There are 10 things that they have to cover, and then there are other things that can cover, and you can look at the plans and look at documents that are very easy to compare plan to plan, one or two page documents that show you what the plan covers. Okay, we're going to get into all that. I'm just sort of telling you up front a little bit more. Okay, so another thing, but if you go back to those original goals, pre-existing conditions, it's no longer going to be the case that pre-existing conditions will count at all. So if you can't get insurance now, starting in 2014, if you have a pre-existing condition, that won't matter. They can't even really ask you about with a few exceptions, they can't ask you pre-existing conditions. So everybody's rates really for a particular health plan are just about going to be the same, assuming you're close in age and assuming you don't smoke, things like that. If you do smoke, you'll be grouped in the smokers. So if you think about it, well, okay, if I've got a pre-existing condition, I'll say I don't have any pre-existing conditions, why don't I just wait to get sick before I buy health insurance? Be a great way to game the system, right? Pretty clever. I could just not have insurance and then wait until I get really sick and then buy it as needed. Well, obviously they thought about that, and one of the biggest tenets of the law, and something you've probably heard about a lot in the news, is this individual mandate. It's kind of designed to account for that. Penalizes people for not having insurance. And there's some exceptions to it, and there's some particular rules we'll get into. And also to counter that sort of a smart issue of only buying insurance when needed, you can only sign up for insurance on the exchanges during certain times of the year, during the open enrollment periods. Okay? By the way, any questions, stop me. We can stop in the middle, or we can do it at the end, whatever y'all want. Any questions so far?
What will happen to these people that they say, well, like some young people, I'm going to take it and I'm going to take the penalty, so they get sick on it.
Well, that side of the system won't change that much. If they choose to take the penalty, which we'll talk about, their actual care, they go to the ER, there's still laws in place. For example, if someone presents to the ER, they have to be treated and they have to be made okay. But after they're the point where they're not in an emergency situation, then they don't have to be treated. So that won't change. They'll still, whether they can pay or not, that doesn't really get touched on under the law. Did I answer your question? Is that okay? Yeah.
Is it true that there's nothing in the bill to enforce that penalty? The penalties?
Well, the penalty is enforced on your tax return every year. So
yeah.
just like any other thing.
But if a person cannot afford the penalty, do the government help them in subsidy?
It's a good question, and we're going to talk about some of that. And let's do that now. There's some exceptions to the rule, and there's some subsidies too, like you mentioned. that help people pay for insurance, and that's, again, a big part of it. Here's what that individual mandate sort of says in a summary form. You have to have health insurance or you pay a penalty, and as I just mentioned, you do that on your tax return every year. So when I file my taxes at the end of 2014, I file them in 2015 for 2014. There's going to be a new box on there probably that'll talk about insurance, and you'll have to fill that out. And you'll have to prove to the IRS's satisfaction that you have coverage that meets these minimum essential coverages. That's going to be just about anything you can buy out there today. If your employer offers a plan, if you buy it on the exchanges, or if you get a plan somewhere else, with some exceptions, that's going to cover most typical health insurance plans, those minimum essential coverages. And there's some exceptions. Let's talk about what the penalty is. It's ultimately designed to come down to these numbers here, the 2016 numbers, but they wanted to phase the law in and sort of start it out light. When you get looking at the numbers, it's not really that light, but when you get into 2016, it's pretty darn heavy. It's somewhat complicated, but you have to take your household income. That would be the income from everyone in your house. And on your tax return, you may know the term adjusted gross income. It's essentially your adjusted gross income with some additions to it. But you take that number for your household income, and you take 1% of it from 2014. Or, if it's a greater number, $95 for every adult, $47.50 for child and children, or $285 per family. Whichever of those two is greater, okay? For most people, it's probably going to be 1% of your income, I would guess. So you take that number, and that's the penalty you pay. And then again, 2015, it goes up to those numbers, increases a good bit, as you can see, 342%, and then in 2016, it increases a whole lot. Then after 2016, that's going to continue to go up, not as much, but it's going to be indexed for inflation, basically. Okay, that's how you calculate the penalty. Now let's talk about some of the exceptions. The first exception, this 8% rule that I talked about, that one, I'm probably going to need to read how to calculate it from my notes because it's a little bit complicated. Those who would pay 8%, more than 8% of their household income for the lowest bronze plan. So if you take that number on your tax return again, and you would be paying to buy on the exchange the cheapest plan they have, and it costs you more than 8% of your income, you don't have to buy health insurance. You're accepted. That actually, they're saying, will probably cover a lot of people, at least in 2014. That's yet to be seen. It's not certainly not something I'd count on. Illegal people who are here illegally, or don't have U.S. That's not just U.S. citizens, but if you don't have a green card or you're not here legally, then you aren't subject to it, obviously. There's an exception for short gaps in coverage. If let's say you lose employment with your employer and it takes you a couple months to get a new plan, you're going to be okay. It's a 3-month gap is the most that can cover. If you don't earn enough income every year to where you don't file a tax return, well, they're not going to really be able to enforce the penalty on you because you're not filing a tax return every year. So if you don't file a tax return, and in 2013 those numbers were $10,000 per year for an individual, $20,000 for a family. So if you don't earn $10,000 a year, if you're retired and you don't earn anything, you wouldn't have to.
So what if they're unemployed for more than 3 months?
Do what?
What if you're unemployed for more than 3 months?
Well, you can buy coverage through the exchanges. That's the biggest resource you're going to have. Or you may be eligible for Medicaid if your income's low enough throughout the year. The Medicaid levels go up, although Georgia's a little different there.
I was on unemployment with 3 children and no child support for 2 years, and I didn't qualify for Medicaid.
Yeah. And that's something we're going to talk about. Unfortunately, Georgia has not expanded the Medicaid program. You may be one of those people who fit in the gap if you're in that situation. there's a gap of coverage because of the Supreme Court decision. We'll talk about that. But basically, it means that Georgia's Medicaid limit, I believe, is like 39% of the federal poverty level. So if you're from there to 100% of the federal poverty level, then the law doesn't help you because the state elected not to let it do that. So, we'll talk about that some. But the answer to your question is the best resource would be the exchanges. You can shop for a plan. Regardless of your employment, you can shop for a plan on the exchange.
I have one. I draw Social Security. I'm raised a 13-year-old daughter that's adopted. And what do I do about that? I don't draw enough to come up with enough to pay insurance hardly. So I don't know what to do about that. What would I do about that?
Well, you'll have to look at the numbers. And by the way, excuse me. Get some water. Excuse me. Excuse me, losing my voice here. The exchanges will answer that question for you, whether you qualify for Medicaid or not. Okay?
They say I don't. I don't.
Well, but, you know, it's a tough situation. You may be in that gap also, and we'd have to look at the numbers to be sure. But now Medicare, if you're on Medicare, that doesn't change either. So for you, not for your daughter that you adopted.
I have a question.
Sure.
Oh.
There's a clause, I believe around page 360 of the Health Care Act that says that the IRS cannot file a lien against your property or your assets if you don't pay the penalty as they could if you don't pay your taxes. Now, if you are getting a refund, they're going to take it out of your refund. But has that been changed from the original law? Because it still is in the original act. Like I said, I believe it's somewhere around page 360 that they can't take action and file any kind of lien against your property. That there's nothing they can do if you don't pay it, in other words.
Honestly, I don't know. It's been changed. I'm sorry about my voice, Bill.
Janet, give him one.
But I believe it's still the same, Jan. I think a federal tax lien on your property is typically for only your ability not to pay taxes. So I'd be surprised if it's been changed. But I don't know the answer to that. Does anybody else know?
I don't know. I need to ask a question.
Sure, go ahead.
What about people that are 89 years old and have a limited income? Are they an age gap that falls in there that they don't have to have, even though they have Medicare? Are they an age gap that will fall in there? There are people in the rest home?
Well, if you're 89, you're on Medicare. Right? Medicare is going to cover pretty much everything you need. I mean, so at 89, you'll be on Medicare.
Okay, another question. What about people that are incarcerated and deaf?
It's a good question. That's an exception.
Okay, I can't say the bottom.
I know. I'm sorry about that. If you're in jail, you don't have to get health insurance.
I mean, I'm not incarcerated, but I was just curious.
Yeah, I know you're not. Good question. Yes.
I know, well, I have relatives that work in prisons, and they have better insurance company than we do. They get their sick, they get the best medicine and everything, so they're already covered. My question is this, I did not know this until one of my neighbors daughters got pregnant. And so I thought, oh, well, when are we gonna have the baby shower? When are they getting married? And I was told they were not gonna get married until after the baby was born. That way the state would take care of the hospital bills and all the baby food and everything. And I think that's one thing that's ran up our medical bills. And then I find out this has been going on for several years, at least 10 years. Well, more than 10 years, I was told. And they know who the father is, but we have to pay for the illegitimate children until they're about 2 years old.
Yeah, I mean, it goes back to the Medicaid issue, and that's, that's all covered under Medicaid, because if they have if they have a baby, they've got a bigger family, and the level goes up for Medicaid eligibility. So it really hasn't changed that much. Yes.
Is it true that if I have 2 children with a lady, we're not married yet, and I have a child with her on the way, they all 3 have Medicaid or whatever, and if I marry her, then I can have Medicaid too?
Live in the same house.
Yeah, that's not really going to change. I mean, as far as qualifying for Medicaid, that's not going to change that much. You'll be a part of the family then, so I suppose it would be true if you met the total income requirement. The total income requirement. So.
What does the limited religious objections mean?
Well, it doesn't mean much. It means certain federally recognized religions can be excluded, but there aren't many. I don't know of any, to be honest. Maybe somebody else does. But if you have a religion that the religion is opposed to health care officially, there is an exception to that for the law.
Now, if a religion or a group of people in a certain religion, if they decide to set up their own insurance company and take care of it themselves, is that covered under that?
As long as it meets the minimum rules that was mentioned in the previous slide. Minimum essential coverages, which we'll talk about. Let me skip ahead. So we can get back, but I mentioned that gap. This is the question I was answering. So, in Georgia, this number is 39%. But because Georgia elected not to expand the Medicaid program, there's a gap where the law really doesn't give any coverage. And let me tell you what those numbers are. I'll rip them down. Okay, the federal poverty level for an individual is $11,490 this year. So if you're not married, it's just you, an individual, you make between $4,481 and that $11,490 every year, you're in the gap. That's a problem. For a family of 2, it's between $6,000 and roughly $15,000. For a family of 3, it's between $7,616 and $19,530. So you can see, there's definitely a group of people where this is a problem. But that's where we are today. Hopefully in the future that'll get remedied as the government works on the legislation.
Some of those who need it the most are the ones that are in the gap.
Yeah, arguably so.
Yeah.
Thanks to our governor.
Hopefully my voice will last. I'm sorry. Here's a few more. They're not exceptions, but these are more obvious people who don't have to, not subject to the individual thing. If you're on Medicare, like I already mentioned, I really want to change. Medicaid or CHIP, that's the children's health care. TRICARE, VA, health plans, or if you get coverage from your employer, that will change. If your employer keeps the same health plan, stay on. No problem. There's some plans that may be grandfathered that don't meet those minimum essentials, but that's pretty rare. We're finding that most of them are going to be needed as essential. So,
I have a question.
yes.
Those that are on Medicaid that have supplements, this doesn't affect them, right?
Medicaid supplements.
Medicare.
Oh, no.
Okay.
Doesn't affect
Okay.
supplements, no.
It doesn't affect you even if you don't have the supplement.
Oh, it
If
don't?
you're on Medicare, you're not affected,
Oh, okay.
period.
Yeah, it
Okay,
does.
but, right on the other hand, you know, Medicare doesn't pay everything, so
You gotta pay that.
we gotta pay it, or we have to have a supplement to pay it. All right, gotcha.
Yeah, I mean,
What
that's
I
generally
thought, but
true.
I wasn't sure about that.
There's really not a lot that
I guess
really
that's
will
a dumb
change for the
question.
individuals on Medicare.
But the government's not gonna
I mean,
get you.
there are some things that change, but not much for the individual.
What I was wondering.
Now, let's say you're above the Medicaid line, but you're looking to buy insurance on the exchange. And you, let's say you're not going to get it through your employer, or you want to look elsewhere and shop around. There are ways the government is going to help you pay for your health care on the exchange if you buy through the exchange. And does that through subsidies. This comes in the form of a direct benefit that you can take, basically a complete reduction in the premiums you pay every month. And these are the numbers, but basically, let's say you're like me, you're a family of 4. If you make in between $23,000 and $94,000, you're eligible for a subsidy, provided you get a plan on the exchange, and provided your employer doesn't offer a plan that's good enough. There's some exceptions to it. Yes. I'm already running out of time. So, those subsidies are big news. I mean, you go on the exchange, you buy a plan, it's going to be a lot cheaper than the government's going to have to pay for a lot of that. Basically, it's going to subsidize it. It comes in the form of a tax credit that's done at the end of the year, but they also allow you to take that every month you can pay the premium. So it's pretty nice.
Question.
Yes.
Can you use a subsidy to buy a Medicare supplement?
No, this only for plans on the exchange. Okay? Is that, anybody else? I'm right on that, right? Okay, just making sure.
Excuse me, does that subsidy go to the insurance company that's giving you a cheaper rate? It does not cover the individual, right?
No.
Yeah, I mean, the insurance company is not going to get paid any less if that's what you're asking about the subsidy. Is that what you're asking?
You're not gonna get any money, you're gonna get a discount. It's not money, it's just a
That's what I'm trying to
discount.
say. You're not gonna get any money in your pocket. It's gonna be.
No.
Discount.
It's a discount.
Yeah,
A
that's
discount's a
right.
better word for it, really. They call it a subsidy.
Yeah.
That's a much better term. You should be legislator. You really need to. All right. This is how you calculate the numbers. Like I mentioned before, it's adjusted gross income plus some additional numbers. But because we're running out of time, I'm going to skip through this.
I want to ask you one
Sure.
question. If you're a couple and you have, one of you is on Social Security and the other one's not, the income from Social Security is figured in with the other individual's income to decide
Social Security
how much you're
income.
going to have to pay?
Yes. Social Security income does count in those numbers. Find out the subsidies.
So you'll have the Social Security, you'll have the Medicare, you'll have the supplement, and you'll have to buy that, but it'll also go toward that. I mean, it'll be figured in with that amount.
Yeah, I mean, again, this is just for calculating the reduction in your premiums for the health plan that you buy in the exchange. Yes. Okay.
Is everybody clear that if you're on Medicare, this really doesn't apply to you at all? It's not going to affect your Medicare coverage or your Medicare supplement? Is everybody here clear with that?
Yeah, I mean, that's exactly. If you're on Medicare, there's really not a whole lot that's going to change.
You're not gonna have to pay a penalty, you're not gonna have to sign up for anything, you're not gonna have to do anything if you're on Medicare.
Question. Well, give you all the same benefits to employees? Is that also, so long as they meet the basic requirements for?
Yeah, there are some grandfathered plans, but like I said, most plans aren't grandfathered anymore. It's been so long.
About 5%.
Yeah. So if you're on your employer's plan, you can keep it. Businesses can also, they have a separate exchange marketplace for businesses to shop for plans. So like our law firm, we're gonna shop, we may shop for a plan on the exchange. We can look on there and find different plans to offer employees. So it's similar, but it's a different marketplace. There's also, if you're a part, you know, if you work for Walmart or some large company, they're required to continue to offer you health coverage through, you know, that's probably, I guess they probably still are, but they're going to have to offer you qualifying health plans. That's been delayed for a year. That starts in 2015. Small employers, that's employers with less than 25 full-time employees. They can get a tax credit if they offer plans through work. So you may see some more health plans starting to show up in your workplace. Pretty good. Okay. I just wanted to show, this is kind of what a form, when you look at the plans on the exchanges, they all kind of will show these benefits pages. If you click on the links, they'll show you, they all look the same. So you can compare, like I was saying, you can compare apples to apples and see what it's going to cost, what it covers. This is only the first page, but it goes on and you can look at them side by side that way. And I know I'm running out of time, but real quickly, I just wanted to kind of go through. We're gonna go through the exchange in just a minute, and so but I wanted to give a quick overview just of some of the numbers. Like I mentioned, there are 10 things the exchanges have to cover. Every plan on the exchange will cover all these things. They're all going to do that. Now they may or may not offer other stuff, okay? But they're all at least going to cover this, okay? So for pediatric services, they're going to cover dental and vision care. Not for adults. You can get coverage for vision care and dental breaks. That's all of the plans will at least have it for kids. Hospitalization, ER, drugs, maternity coverage, those are all covered in every plan on there, okay? Now, you'll see when we go through it in a minute that there will be 5 levels of categories. There's real, you know, this is really sort of where you decide how much risk versus reward you want in a particular plan. So I'm going to pay higher premiums, but they're going to cover more. Or I want to pay lower premiums, but they're not going to cover as much. They have different levels. If I go with the bronze plan, I'm probably a guy that's a little more healthy and don't need as much coverage. So, I wanted to give some example numbers in the Dalton area of, I just looked this up in Whitfield County, some of the plans they offer. Y'all can just take this chart in. Again, we're going to go through and actually look at it in a minute, but I just wanted to give you an idea on the exchange. And again, remember, these do not include the subsidies or discounts. So if you fall between those income numbers, these numbers will look a lot different for you. They'll be a lot lower. But these are the starting prices for the plans that I found when I looked at it today when I was getting this slide together.
Question? They all have a similar deductibility?
No. There are going to be different types of plans like HMOs, PPOs, and they'll be different. I mean, that's what's important will be at what level, going back to this, whether they're bronze, silver, gold, or platinum, because that tells you how much it's going to cover. That percentage of the total average cost of care comes down to your deductible and your out-of-pocket costs. Okay. So they won't all be the same, but within the bronze level, they'll be basically the same. Within the silver level, they'll be basically the same. Okay. That's all I got to say from the presentation side. Any questions? I'm sorry about my voice. I don't know what's wrong with me, but.
So if you ain't got a job and you ain't got an income at home, this or something, you get in that gap where this ain't, you won't be getting no county insurance, but you got some medical issues.
You may be eligible for Medicaid. If you have no income whatsoever, your family doesn't have any income,
Right.
you're probably going to be eligible for Medicaid.
Will that be on there?
Yeah, if you go on the exchange, they'll tell you if you're eligible for Medicaid.
Is that price that, like, the individual 50 plus, is that included what your employer pays or what just your cost will be?
These are only plans you buy on the exchange.
Only, okay.
If you have a plan through your employer, that's going to be whatever your employer chooses to be, or whatever they can buy, whatever deal they get. These are only if you choose to go outside of that contract. I've gone over my time, so I think Dr. White's next. He's probably a much better speaker than me anyway.
And also has offices in Chatsworth and Calhoun. In 2006, Dr. White began the Halos for Health program to promote educational health and to provide incentives for children to maintain well child visits, which he believes is important in early detection of potential health problems. Dr. Barr is a graduate of Loma Linda School of Medicine, and we're honored to have him as our next speaker.
Take off my coat, is that all right?
Yes, good idea.
Good, thank you. I appreciate Jan inviting me to come speak to you this evening. And when she talked to me, I said, well, I'll be happy to talk about the Affordable Care Act. Then I saw the itinerary and questions that might be asked. And I'm like, I'm not an insurance agent, I'm not a lawyer. And so I'm like, you know, why do you want me to speak? But basically what she wanted me to talk about was why the Affordable Care Act. I think that's the bottom line. Right now, you're talking numbers. You're talking what would be this, what would be that, which are real things for real people, you know, finances. And I would have to speak to you from my heart and simply say to you that, you know, I live the Affordable Care Act. I put it like that. It's been my life since 1981, so this is not something new to me. I put things in place back in 1995 that said, one person I want to keep in my rearview mirror is the government. If I can do the quality care and do the right things for patients, I would never need to worry about them. Regretfully, that's not the case of medicine in America. That seems to be very few and very short when it comes to physicians who have that kind of background and understanding to approach. So when I make these comments, it's not comments that I want to make that are just about me, but it's just about the reality of what healthcare is all about. John showed some unbelievable statistics up there. He showed statistics about healthcare in America, and I don't even know if you got it. It probably went right past you.
I got it.
The bottom of the list for all industrialized countries for healthcare is the United States of America. We have the worst healthcare in the world.
Yes, we don't. That's so
Now we
nice.
turn around. Now we turn around and we say, "But we got the best system." No, we don't. We have the worst system. And as a result of that, we have nothing but political outcries and ideology. And ideology screams everywhere. I'm not here for a political debate. I could care less. But I just want to say this much about it. The bottom line is, from my belief, God created us, and He has us here to take care of one another. And that's the reason why we exist. No one of us is an island. All of us are here to benefit and to help one another be the best we can be. And as a physician, that's the credo I took. When I came to Dalton, Georgia in 1981, I can tell you this much. The pediatric surgeon there at my school was a great guy. And I had a patient that I was taking care of, and it was a few months before I was to leave. And I went to the surgery to be with the kid as the pediatric surgeon did the surgery. And I was sitting there just observing and watching because I just wanted to make sure my baby was going to be okay. And he saw me there, and he was doing the surgery. He says, "Jeff." I said, "Yes." He says, "You going to Dalton, Georgia?" And I said, "Yeah." He said, "Have you lost your mind?" I said, "No." He said, "I'm worried about you." I said, "Why?" He said, "I'm afraid I might read about you in the news. You might be dead one day." I said, "No, you'll be fine." "Why then? Where would you go to Dalton, Georgia, man?" I said, "Because they need quality physicians." He said, "What are you talking about?" I said, "The state of Georgia has the highest infant mortality and morbidity rate of any state in the United States." He said, "What?" I said, "Yeah, they're in bad shape down there." And he said, "You kidding me?" I said, "No, I'm not kidding you." He said, but you're black." I said, "So what?" He said, "But they might kill you." I said, "No, man." I said, "You don't understand anything about people in the South. I've learned about them." I said, "My wife is from Alabama." He said, "What do you mean you learned about them?" I said, "They're used to black people take care of the kids." That's a true story. I'm not lying to you. And he says, "I'm going to check on you." You know, he did. Several years later, he actually came to my home in Dalton. Remember, drove it. It was in Birmingham for a meeting, rented a car and drove all the way from Birmingham to my house to make sure I was alive. And the bottom line to what I'm trying to say is this, people, and that's the heart of the whole essence to me of medicine, why we're here, what healthcare is all about. It's to get out of that statistical deficit of being the worst. That is talking about mortality and morbidity, folks. That's not talking about cost. Our cost is still way above everybody else. We pay more money for inferior care. And that's the bottom line. And that's not a statistic that's happy to be about. Another statistic that's hard. We kill over 100,000 people a year. Did you hear me? We, physicians, hospitals, kill you when you're not supposed to die in America at 100,000 a year. That's not wonderful statistics. And you can talk about all you want to in paying for your bills and paying and how to get your insurance, but the bottom line is, what are you really buying? What are you really buying? That's the question. What are you purchasing when you pay your premiums? What are you really purchasing? And that's the question that we're not asking. We're not asking what we're purchasing. All we're talking about is, what does it cost? And most of us are thinking about how we pay for our medications. That's what's in most people's mind. How to pay for my drugs. How to pay for that hospital bill. Something catastrophic happened and I got to rub through with cancer and then these bills pile up and you're so worried about that. And I stop and think, why in the world do they have cancer? Why are you taking medicine in the first place? You see, that's the real issue. And we're not addressing that. And as a nation, we refuse to address it. And we have this system that has been taking money out of our pocket in the trillions of dollars a year and using it to get rich. And we sit back and play political games. And you go like, what? Well, why would I say that? Well, you saw a statistic. We're the worst. So I'm not lying. How can you be the worst to pay all that money? Obviously, you're not paying for what you what? What you're getting. And you can talk about me all I want to. Any political party can jump me. I don't mind. Come after me. I'm ready for you. They will never bother me. They stay as far away from me as possible because I know their lies and I know their garbage. And there's two things I hate about life is lies and ignorance. And we live in the United States of America where lies are propagated as truths and ignorance is actually pat you on the back. Don't check me out, just believe me. And that's what ignorance is. I don't mind the stupid person. They're okay with me. They don't have a clue what's going on. That's fine. But the ignorant one is the one who actually didn't know what they're talking about, hasn't checked out anything. And just stand up and just talk ideology and rhetoric. So what's the bottom line? Well, I lived the bottom line. When I came to work in 1981 here to Georgia, the government was finally trying to enforce having well-child checkups. The American Pediatrics has been fighting for years to have well-child checkups covered. Somebody please cover it, because no insurance company would. The only people that stepped to the plate was the government. And it wasn't enforced, it was like, yeah, you do if you want to. And since most people never got it, they didn't go what? To the doctor's office to get the well-child checkup. But finally, after push and push from American Pediatrics, we fought with tooth and nail. We finally got it to be recognized that we need to push this and get immunization started. When I came in 1981 to 1985, I had the distinct, horrible honor of being the #1 admitting physician in Hampton Hospital for 4 years running. I used to see between 20 and 25 kids a day in the hospital before I made rounds before I went to my office to see patients. That was horrible, folks. I would deal with children that would have meningitis. I used to do something that the kids come out that they don't even know what I'm talking about. I said, have you ever done a subdural tap? They're like, huh? What's a subdural tap? They've never seen it. I used to do those all the time right here in this hospital, right here in Dalton, Georgia, trying to save a kid's neurological status from meningitis. I've had so many kids a year that would die from H influenza. I lived it. We had 3 units up there in that hospital, 3 floors. And that's what I would run between 3 floors. Now that we have gotten the coverage for preventative care by insurance companies, after a lot of lobbying and the fear from Clinton back in the 90s, finally the insurance companies started covering preventive care. The government began enforcing you do preventive care, and we begin vaccinations, and guess what? We have half a wing now for all the pediatricians in Dalton for a hospitalized section. Half a wing. That's quality. That says we're making a difference. I think we have great doctors in this town. I'm not here to belittle any one of them, but it took outside forces to finally do something about it and pay for it, and you started getting it, and we started doing something to make sure you got it, and now all of a sudden we see this change. But I like seeing kids not dying, don't you? Yeah. It makes me happy. And to not have that many patients in the hospital, I rarely go make rounds in the hospital. Now, I'm delighted. I'm pleased. I'm happy in my lifetime to see that change. To see not all those kids in the hospital, but whether they're at home or at school somewhere else. Praise the Lord. And you go like, gee, that should make that number come up. Well, we just begin to touch what other nations have been experiencing. We're still not there. We're still not there. And I will tell you this much, you go back through history, sure, the fear of the Clinton administration pushing a healthcare program made the insurance industry start doing things. You would probably get underneath my breath, I despise the insurance industry of healthcare, I do. It's the worst in the world. And this is what we're trying to sell you, is this you should be happy with it. I take care of kids right now, every day, and I'll tell you to my face, and I'll say this to you, and you can attack me all you want, and I'll stand there and I'll give you case after case after case. The kids who receive the worst care in my practice are only those who are on insurance. That is private insurance. They receive the worst care in my practice. And he had that statistic on the board. Did you see it? The reason why you don't go to the doctor is because of what? Costs. My copay, my copay, my copay. And do you have to do that test, doc? I don't want it. Because I have to what? Pay a copay on it. And yet they're paying out premiums what? Every month. And they're the ones in the office that refuse to get they'll come in for their well-child checkup and say, can I get by without that test? Doc, do I need to do that test? I don't want to do that test. They have a right to what? Refusal. So I can't what? Can't do it. And I watch them cry tears when they say, well, if you only told me, I would have done it. And the kid's diagnosed with something terrible. And I look at them like, but you're the one who told me what? Not to do it. This is the United States of America. And we're in this room talking about costs. That's important. But I just want to do a reality check. Ask you what you buy. And the Affordable Care Act, before I get there, I'm going to go one more stage. 2006. President Bush. I really admire the man. Unbelievable. President Bush read the RAND report. How many of y'all know the RAND report? Roger, you know the RAND report? You know what the RAND report said? If the medical, what do you want to call it, healthcare industry in the United States of America would become computerized, 2006, not even thinking about computers. If they become computerized, it would save the nation $260 billion a year. Did you hear me? 200 and what? 60 what? Billion a year. What do you think that did to our deficit? Bush heard that, read that, and he looked at it and said, it made all the sense in the world. He said, I'm going to do something about it. And he went out to do something about it. The man stuck his neck out because nobody else had been willing to do anything about it. And he stuck his neck out, and he said, the first thing we got to do is, I have to put some, how many of you have heard of this right here? This term. Anybody ever heard that term? How many of you have seen that on any of your insurance bills, or what do you call those things? EOBs.
Oh,
Yeah, ICD-9s. Yeah, you probably think it has something to do with your payment, right? Yeah, that's what the insurance industry would like you to believe. ICD-9 stands for the International classification of diseases. How did I like that? That meant this is spread what, United States? No, it's spread where?
Worldwide.
Worldwide. Doctors around the world want to have better quality and want to improve care. And the more we share data, the better we can provide what? Care. So if I can do something in my area and I say this is the diagnosis and you can see that I do a better job than you do, then you want to learn what I'm doing. And if I know what you're doing, then we can do it and we can both all have a better what? Outcome. This takes care of human beings. This makes sure that your diseases are handled properly. The ICD-9 has 16,000 disease codes. That's what they have. This was back in the 1960s. Right when, I guess, a big industry came along called healthcare insurance in America. They became robust about then. And they took these ICD-9 codes and codified them to what we may today be really the real codes, which you call CPT codes, which are the codes that are about how much you pay. And they tied this to the CPT codes. And then they decided, if I can tell what the diagnoses are, I can tell what code should be, and I can now control what I pay. And they put that into an assurance machine, and they honed this thing down to science. They have actuaries who can spit this out in their sleep at night. And they have this down to such a science that they were not going to give this up. ICD-10
144,000.
You heard it right.
Let's divide it down a little bit more.
But it's not really, this is really good stuff here. Let me just, he said it there, but I'm going to say it's 64,000 plus codes. Why? It has nothing to do with this. This has to do with how I diagnose your diseases and how I share data. The rest of the world has been on this since 1992 or 4, somewhere. Check that out. The rest of the world has been using this, and we're still using this. And so what President Bush saw was, if we can start using this, we can force all the doctors and everybody to change and start doing a different insurance, different IT computerization. And if you start doing something new in computers, you're going to get to what? Everything new. Right? That makes sense? Right? Isn't that why you have different phones today rather than flip top phone, cell phone? Right? Everybody got smartphones in it, right?
Yes.
No matter what, right? You don't use no flip tops anymore, right? Remember the days you didn't have cell phones? And you can't live without your new phone, can you? Well, this is what we're saying here. He said, let's change this. And if we change this, we can evoke a major change. And we can say what? Start saying what? Right? Makes a lot of sense, doesn't it? The insurance industry came along and they said, the lobbyists and the powerful people and all the politicians they got in their pocket, and they went to said, this would cost us $1+ billion to change the system, to change it. But they knew they would have losses. They were what? Crazy. Because they would lose their fine-tune what? ICD-9 controls. Yeah. They blew Bush out the water, almost killed the man, to stop that from happening. Because they would have to spend what? $1 billion. Who cares about saving 260? These are facts. Check them out. This is stuff that I sit back and I can't stand lies and all this garbage. And why? Because this hurts our what? This hurts my ability to take care of you. Which is why the whole industry of healthcare insurance exists, isn't it? Or is it to build malls and skyscrapers? That's where your insurance money is. That's who builds them, by the way. All right, so anyway, when we get through this situation, along comes a new administration who says, enough of this hogwash. We're going to change something. And what's the change for? It started with the what Act, the Recovery Act. Buried in the Recovery Act is the High Tech Act. You know what that is? That act was to get doctors to get computers. Did you all know that? To force doctors to get computers. Aiming at what? that 260 billion. If we get computers, we'll start computerizing our work. And he says, we'll give you money. The biggest argument doctor has, we can't afford it. Well, we'll give you the money to buy it. But by 2017, if you haven't bought one, we're going to start penalizing you. And that's when you hear about get all upset because the word penalty. Well, remember I told you, I did this in 1995. And I was trying to tell my colleagues, it changed my whole life when it comes to take care of my patients. It improved the quality of care beyond belief. And I don't have to tell you this point because it's the facts. You can look on your computer, nothing but the facts. In 2008, 8, a company called the National Center for Quality Assurance put together from 2001 Institute of Medicine report that our healthcare system stinks, and let's change it and start treating patients differently and learn how to handle chronic diseases and take care of their problems and do it right instead of doing it wrong. They put together what they thought would be the best parameters for a doctor's office to have. In 2008, they put out these parameters and they said, if you want to volunteer to see if you meet those parameters, we'll let you try and we can either say yes or no and we'll evaluate you. That first one didn't include pediatricians. They only did family practice. 2011, they did pediatricians. March. In June, I found out about it, and our office, the first office in the state of Georgia to be level 3, the highest qualifications for this award in the state. We're the first one to get this recognition. Now, why? Because I had insurance, I had a computer thing, and I could do what nobody else could do. Because that's what quality is all about. It's about doing what you need to do to take care of who? Take care of you. And so, this is what was in the Recovery Act. Then the following Recovery Act came what act? The Accountable Care Act. What is the Accountable Care Act all about? It's all about, what's the first thing that they instituted? The Patient's Bill of Rights. To make sure that you couldn't be abused when you went somewhere and people got information about you. I could talk all day about this. But the second thing about it was, we're going to make sure that insurance company can stop this felonious thing of having pre-existing conditions. I have been fighting that since day one. I used to have parents come and say, I got a new job at another company, and they won't accept my kid because they saw he had otitis media. Do you all know any kid that hadn't had otitis media? And because the child had otitis media, that's a pre-existing condition, and the child couldn't be insured. And they asked me, could you change my records? What do you think I told them? No, I can't do it. So they would leave my practice, go to another practice, and not ask my records. So that other practice could give them a statement that said the child didn't have what? Isn't that awful? And asthma. 25,000 kids a year die from asthma, a treatable disease. And if I put that on your child's record, your child had asthma, he couldn't get insurance. So that made pediatricians not put down what? Asthma. And you walked around believing your child didn't have what? Asthma. He has an attack and die. Because you were unprepared. And I had to do that because the insurance company would not what? Insure your child. To this day, 600,000 kids right here in the state of Georgia, 600,000 plus kids, under the Accountable Care Act can now get insurance because the pre-existing clause was dropped. And the list goes on. Don't talk about women's care. And one of the most abused adults in the world is a woman. How in the world they can tolerate us men, I have no idea. I heard a man get upset. My insurance program on the ACA is going to go up, and you're going to make me pay for stuff like pregnancy and this. I don't get pregnant, and I don't have that problem. I wish everyone said, well, let's get life insurance policy and let's knock out all men. If you have a PSA on it, we don't pay for it. Insurance is about co-helping each other, right? And as far as I'm concerned, a woman is a human being. And I know that everybody I've met had to come out of some woman. How in the world can I not want to pay an insurance policy because I'm not a woman that covers pregnancy? I'm sharing the what? I'm sharing the load. Everybody has a right and a responsibility to share part of the load. You can't ask one section to do something without the other section doing it. You can't do it. It won't work. So let's all buckle up and share a load and stop complaining. Yes, you might get higher premiums for some of you who got low ones, but most of those are probably junk insurance programs. You know junk insurance programs? They have limits on it. They have annual limits on it. They have high co-pays. They have the co-pays you don't want to pay for a test for. They got the co-pays you don't want to get this for, and you're getting by because you have insurance. That's not insurance. That's junk insurance.
If you're healthy, you're okay.
If you're healthy, okay. And the reality of it is, that's a gamble. Because health is as erratic as the next 5 minutes. You walk in the door and get hit by a truck, your health just went out the door.
That's right. Yes.
So the whole issue is you share the burden together, and together we share the burden, and all of us pay a price. I'm not asking any one group. I don't think rich people should pay it by themselves. I think rich and poor alike should pay the price. And we should pay it at whatever level it takes. And let's stop complaining about things that are trying to improve your care. It's regrettable. I will tell you, I'm the last person on earth, because I already told you, what I want to keep the government in my rearview mirror. I'm the last person on earth that wants the government to enforce these things. But I'm also the first person on earth when stupid people won't do it themselves. Now, did you hear me say it? I didn't say ignorant. Because if you're ignorant, I don't like you. So you let me call you stupid because at least I can accept you. It's when stupid people won't understand, then the government steps in because somebody has to take care of somebody who can't what? Can't take care of themselves. They just don't get it. They don't understand. They don't see the real picture. And I can go on, women, they're not going to pay for it. You've got to have insurance programs that will pay for your mammography. And they're going to pay for you to get preventive care without paying a copay. So if I put a copay of preventive care, who's going? Nobody. So now you take that away, I might get you up in. And when you get your pap smears, they're paid for. Isn't that fair? I think that's cool. Because we sit here and watch football games, everybody got the pink little things around, and breast cancer, all breast cancer. But when you come down to pay your premium, you go like, I'm not paying because I'm not pregnant. It's all about taking care of your what? Your women. I think they're worth taking care of, don't you? Yes. I really ought to support anything that's going to support their preventative care and going to take care of them. I hate breast cancer, and if we can wipe it out, I think it's worth the cost. Why should I have to have cervical problems? That's ridiculous. And I can just get a pap smear. These things are what we're talking about are being eradicated in the Affordable Care Act. It's stopping insurance companies from not covering that stuff. And it's also going to say, let's stop charging old people more money than young people. Are you following me? Yeah, when you're young, you get low rate. When you're old, you get high rate because the risk of you getting sick is what?
I cry myself to death about my grandmother every day.
Yeah, so what they got, and they ask young people what? To pay more, so the older people can what? Pay less. So we can just ask you questions like, what's your age, what's your address, your name, and do you smoke? And cut out all that other stuff. I've overdone my time. Shut up. I could go on all night. I can get on the pulpit on this one. Okay, and I can dance till the sun goes up and down. Because you'll never get me off the subject, and I'm not afraid of anybody.
All right. My daughter is very much like you.
Praise God.
She's under that recovery plan. I used to have to go back when I have blood tests every 6 months. I have to go back in. Now everything is computerized. I have a password. After my blood test, it comes out on my computer.
Isn't that cool?
It even comes out on my cell phone. He set up a
Look,
section on my cell phone. What makes me sad is about 9 years ago, I saw a man from Africa come to America. He went to Dalton. And 400 people were waiting to be serviced by him and his volunteer staff. They normally did it in Africa and Haiti, but they were in Dalton, Georgia.
And they was getting the same response.
And I'm thinking, my God, that's just like
Because you couldn't get
third world care.
You couldn't
We
get
are
it.
being third world care. And he did it again this year in Kentucky, I think.
Dr. White,
Yes,
they're
ma'am.
scaring people to death, saying doctors are gonna quit practicing.
Of course they said that. But part of the Affordable Care Act, do you know what they're doing? Let me just tell you something, it might blow your mind. The Center for Medicaid and Medicare and Medicaid Services, called CMS, publishes a what we report according to what would be the average price you should pay for a certain service. Okay? They do that every year. And they look at the whole nation, they break it down. And they have rates go by every year. Do you know that in the state of Georgia, that what your Georgia government pays me is 1998 rates? Yeah. How many of y'all can survive on that? Now, I'm not talking about me because I have all the doctors here in town. I mean, all of them. We're the lowest and the least paid physicians in the entire United States of America.
Really?
Yes. So now the government steps in, the ACA Act, and says, you can't do that anymore. And since your states won't come around and do it, we're going to pay you on a federal basis for 2 years, the 2009 rates or 2013 rates, whichever one is higher.
So you'll actually be getting more?
We're getting more money now
Okay.
because this act's in place, so that we'll keep your doctors here in rural America. But the state is getting rid of your doctors like flies because they won't pay us anything. And sure, I gotta admit, thank God, that they haven't cut us, but there's not much to cut when there's nothing there. And they haven't cut us. Every year they threaten to cut us, and we go down there and fight, please, 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 because we can tell horror story after horror story of all the doctors leaving. The hardest thing for us to get is a doctor here in Dalton, Georgia. And I sure wish they'd change the whole system. Let me just say this much to you. I mean, I hate this. I'm sorry I said I wasn't going to do it, but I'm going to do it. I'm going to say it here. And I'm glad I got somebody here that can hear me.
Rule 6 is you're not going to hurt my feelings.
I'm going to just say this much to you. If I want to get a doctor in Dalton, Georgia right now, another doctor in town, and I say, here, come to town, and fresh out of school, great candidate, come to my practice and work. Oops, sorry, I see 60% Medicaid. Now here's the issue. If I'm a practice that says I don't see Medicaid, I can make a living. And I see only insurance people and just get my money. When I do that, if I'm an insurance practice, I can get a doctor come in town, he can apply for his insurance numbers, and while he's applying, he can see you as a patient. You walk in the door, you can see that doctor, and the insurance company will pay him under my number. Okay? Until he gets his number. That's the insurance company. Same state, same everything, insurance company. If you come to my practice and I see Medicaid, Medicaid says you cannot see a patient Medicaid and charge them Dr. White's number. That's fraud. That's our state. And it takes them 3 to 6 months to get a Medicaid number. And then they have CMO numbers that take another 3 months. So for 9 months, I cannot have him see a patient and make any money. So I got to pay him for 9 months free. Now, how likely is it that I'm going to get a doctor to come to town and see a patient? What's the likelihood? And why won't, it's arbitrary. Why won't our state drop that ridiculous requirement that I have to wait 9 months before I can even have that person generate a salary and I'm supposed to pay them? And you pay me at 1998 rates anyway? And I ask you that question, how likely am I going to get a doctor? How am I going to get one of the Tyson to come to town? The only doctor I can get is I take one from somebody else. Now, is that creating jobs?
No.
And we can't get our legislators to bend one iota on that and do something about it. That is the most ridiculous thing on earth. And it's arbitrary. The insurance company can let them work. So who's the only person that can have a doctor see them new? Somebody has insurance. So, why we like ACA. This is why we like ACA again, right? If I can get more insurance people, then I can get more what? Get more physicians in town. I get more doctors. Does that make sense? So do I support this act? Yeah, is it a perfect act?
No.
No. By no means is it perfect. But is it trying to correct a problem?
Yes. Yes.
And we got to do something, right? And I'm saying let's go for it. Let's do it. When the numbers look bad, just remember what I had to say. It's all about taking care of you. And like I said, you can bring anybody you want, all the way up to whoever you want to find to come talk. I'll be happy to talk.
Alexandria, or Allie, who is a health navigator employed by the University of Georgia Cooperative Extension to cover the 10 counties of Northwest Georgia. Her role as a health navigator is to provide education and outreach to individuals, families, and small businesses about the Affordable Care Act. In that role, Allie is available to answer questions, give presentations, and provide enrollment to anyone seeking information. And if you want to schedule a meeting with her for afterwards, she'll be around after the meeting. We also will have either Allie or Whitney, who's over here, another health navigator. So we will have different health navigators in this area, in particular here at the community center, as needed, right? I mean, you're working with Thomas to set those schedules. So they will be available to be able to help you one-on-one, to help your family, to help your small business. Okay, Allie?
Okay. Well, good evening. If I need to shift a little stretch, I'm okay with that. It's been a little while when I stood up, I was like, I'm just kind of creaking a little. I think I'm a little good for that. But anyway, so I am the UGA Health Navigator for the Northwest Georgia area. To give you a little bit of background about the navigators and what their role is, UGA itself, the University of Georgia, has 12 navigators across the state that cover certain areas, but there are also other groups that have navigators as well. So Whitney Griggs is with Healthy Mothers, Healthy Babies Coalition, and so she has one, and then David, I'm sorry, I forgot your last name. Right, and he works with one of the federally qualified health centers in this area. So there are others that are around. So I'm not the sole navigator for this area, but I am the one covering this area for the University of Georgia. So what does a health navigator do? First of all, I answer questions. I answer a lot of questions. People call a lot. And on the information sheets, and if you didn't get one, we can make sure you get one. I put them around on the tables. My information is at the bottom, so you can call me or email me if you have any questions that don't get answered at this presentation or as they come up when you go through enrollment, or if you have someone else you're trying to help do enrollment. If you want me to come and speak to any other group, I can do that as well. Whatever you need to know about the Affordable Care Act, I'm available to ask those questions. If I don't know the answer, I'll find it out and get back to you. So, also, as a caveat, a lot of times I get asked, so are you Obamacare? Are you the one that's Obamacare and trying to sell it to us? That's not the case. So the other thing that is with the role of a navigator, we are not Obamacare. We just help you to understand Obamacare and how it applies to you and what you need to do in order to comply with it and what it means for your family. So no, I am not Obamacare, but I can help you understand it. I do outreach and education, and that is my role. So I'm going to go over a few things that they've all said that our previous speakers touched on. I just wanted to touch on those. And then I've got a video that shows you what the enrollment online looks like. There's two reasons I'm doing a video and not doing it myself. One, the first reason is I'm not signing up for insurance, and so you can't create duplicate accounts, so I couldn't go through and do a live session, but it will show someone who's doing it, so it'll be very similar. Second, yes, the website is malfunctioning. That's the biggest question I get all the time. Yes, the website is malfunctioning. Have I had successful enrollments? Yes. Some of them are in this room, or they were a few minutes ago. I don't know where she went. But I've had successful enrollments here in Whitfield County. And then also a few others. I've had people get through the whole process. You just have to be patient. So you have to, if you're sitting at your computer, you may want to have something else to do. Have you?
No, Elena did, but how can you tell if the enrollment is successful if you haven't heard from your insurance company, or if you contact the insurance company and they have no idea of your enrollment?
Well, then that sounds like an unsuccessful enrollment.
Elena has
so
not been able.
You've not heard from your insurance company?
Elena, she went through when you were here, she's not heard from. So
okay. Well then,
not a successful enrollment, is that correct?
Then that would not be, yeah, you need to make sure you're hearing from that insurance company after you follow up. So when you hit enroll, and they'll go through the whole process in a minute, I'll show you. When you hit enroll, it'll take you to that insurance agency's website where it'll talk to you about how you submit payment. And you can, as with any insurance company, it's private insurance. Obamacare is not one single insurance plan. It's a variety of insurance plans offered by several different agencies in the area, and it depends on what area you're in. But you will be taken to that insurance agency's website and you make your payment that way. So that's how that will work. And so if you haven't heard, then yes, you need to follow up. You need to make sure that you did have a successful enrollment. If you haven't heard from them, you're not getting an insurance card, they haven't followed up with you, you need to make sure you actually have coverage. So that's something to be aware of. And a lot of that is going to be likely due to website issues. They're working on it. There's a big tech surge. That's what we're being told as far as pushing into it. And we're being told that by the end of November, it's supposed to be working much better than it is now.
I've heard that once you opt out, if you decide, well, I'm gonna have to take it, so if you wanna go back in, can you opt back in? Once you opt out of the insurance?
So what you do when you go in and you look at your plans, you can just walk away as far as like log out and then log back in and make your selection. So you don't have to enroll, but you'll still have an account because it'll show you on the video. You'll create a username and a password that will always be your account on that website. And so yeah, you can go back in and enroll. So. So
the people that don't have a computer are people that
okay. So there's several different ways to submit an application. You can do it online through healthcare.gov. That's what this will show. If you don't have a computer, don't have access to a computer, libraries have been trained on how to do this. I will also be here on Thursday afternoons, other than Thanksgiving for the next few weeks, but I will be here on Thursday afternoons at the community center for people to come in and I can help them enroll if they don't have access to a computer. One second, I'll get to you. You can also fill out a paper application. I have paper applications with me tonight if you want to look at one. Or take it with you, that's fine by me. And then you can also call the call center and they'll take it over the phone. You can apply over the phone. So, your question? I will be here likely from noon to 5 every Thursday. This Thursday I've got people who've already booked up for me, but so next Thursday will be a good time to start.
How do I get on the book?
From after this week, it'll be just drop in when you come in. You can just walk in. You don't have to set up an appointment. So. Okay, so a few things. So everyone has to have insurance. That doesn't mean they all have to have insurance through the private marketplace or the insurance marketplace. So if you have Medicare, you've got Medicare, that counts. If you've got Medicaid, you've got Medicaid, that counts. If you have insurance through somewhere else, that counts as long as it meets those minimum essential coverage that our attorney was talking about earlier. And so as long as you've got coverage, you don't have to go to the marketplace. It's not required that everybody purchase insurance this way. You just have to have proof of coverage somehow, unless you meet those exemptions. And to answer your question about those who don't have a job, don't have income, or they have little income, they're in that coverage gap, you can file an exemption, and you're going to file taxes because they're still going to ask about your proof of coverage. You can file an exemption with the healthcare marketplace, and that will go in with your taxes so that they see that you can't afford any of your insurance because you're in that 8% that he was talking about. That if insurance is more than 8% of your income and you don't qualify for subsidies, it's definitely going to be outside of that. You can file that exemption. So that would be, and I heard you saying something about clients you had that were.
We do community outreach, and a lot of the people that we work with are very
working poor.
Yeah,
Sure.
And so we have a lot that the children in the home are covered,
Sure.
that mom and or dad are not, and that I don't see any way that they can afford. I mean, they're doing
Right.
good to just kind of like day to day.
I understand, yeah, and I get a lot of questions about that. So when you're in that coverage gap, really not a whole lot changed for that group. They didn't have access to insurance before. They don't have access to insurance now. They also are not required to pay that penalty because it's unaffordable to them. They just have to file an exemption saying it's unaffordable, unless they're not filing taxes. If they're not filing taxes, they don't have to file.
So if the least expensive premium, so to speak, is less than 8%?
So if whatever they pay, whatever they would be paying would be more than 8% of their income, then that's unaffordable. That's considered unaffordable, and they are not required to purchase insurance. So, yeah. So it leaves them without access to insurance, which is unfortunate, but they are not hit with a
I was
penalty
hoping
on the
they
other
would
side.
finally feel that.
Right.
And I was looking at theirs, the family of 4. I mean, like even us having a job, we're like right under that line.
Sure.
Yeah. Georgia expanded
Right,
Medicaid.
expanded Medicaid.
We would not be in this situation.
Right.
If you live in another state,
Yeah, well, we have so many people that are asking us, what do we do, what do we do? And we're like,
You write to your congressman and you ask them to get expanded Medicaid in the state.
yeah, well, I mean, that are asking us now, like, what about today? They don't
Let me
know.
answer Let me answer that. Refer them to me. I can help them answer those questions. Refer them to our other navigator in the area. If they have specific questions about their situation, have them call me. I can help them. So, yeah.
Well, we may even give you, if you wanted to just do a group, we can get them
Sure.
in our office and you can help them.
Yeah, I would love to do that. So, and I can do that for any group that anyone, if your church needs to hear this, however you want to do it, we can do that. But yeah, people refer them to me. That's fine. I will answer the phone. So,
Thank
yeah,
you so much.
absolutely. Another thing I wanted to touch on is the timeline for the marketplace. That's something we haven't talked about either. So open enrollment, everybody talked about October 1st, October 1st, October 1st. That was the big date. Now a lot of people are starting to talk about December 15th as the end of open enrollment. That's not exactly true. What that means is December 15th, you have to go through the whole enrollment process and pay for your insurance policy by December 15th in order to have coverage starting January 1st. So that's just to have coverage starting in the new year. Now, if you buy it from any time starting now up to December 15th, it'll start January 1st. You're not going to get coverage any sooner than that. You'll make one premium payment and it'll begin January 1st, then it'll be a monthly thing. If you do it after December 15th, it'll start the month after that. You have until March 31st in order to enroll through the insurance marketplace without penalty. And that's something that's changed recently. It was February 15th to avoid penalty, but now they've made it the entire open enrollment window. So you have until March 31st to purchase insurance through the marketplace and not face a penalty. If you were one of those who would face a penalty to not have insurance. So that's a big thing to know about those timelines. Let's see here. We talked about what the plan would cover. So you get access to certain free preventative services. So immunizations, and those are, even for adults. So if you need your booster shots and you're outside of being on peach care, if you have your children on peach care, but you need your immunizations, your tetanus shot, things like the immunizations, those preventative services are covered without a copay. And that includes those things that you're talking about, like mammograms and pap smears. Anything that's rated an A or a B by the U.S. Preventative Services Task Force. So that's a long list of things that are considered really good for your health. They've done a lot of research saying that these are good for helping people to get that quality care. And so as long as they're rated an A or a B by the U.S. Preventative Services Task Force, they're offered through your insurance company without a copay. And so those are things you can get for those preventative services. That applies to Medicare as well. So Medicare was able to receive those preventative services for free, those Medicare beneficiaries. We talked about no denial based on pre-existing conditions. They also can't throw you out if they find out you have a pre-existing condition. That's something that a lot of people, they may have gotten insurance and then they found out that they made a mistake on their application, or they didn't list that their child had otitis media, an ear infection, and they threw them out of the plan because they lied to them. But that pre-existing condition status is nothing that matters anymore for insurance companies at this point. They can't ask about it, and they can't charge you different based on it, and they cannot prevent you from having coverage because of pre-existing conditions.
Is that health and life insurance?
That's health insurance only. Yeah. So this is all about health insurance. That's the other thing. I get that question a lot. The marketplace is only for health insurance, so you're not going to get life insurance or house insurance or any other kind of insurance through the marketplace. It's about health insurance. So know that that is
I didn't know it was a pre-existing law.
Yeah. Let's see. We talked about the minimum essential benefits. You saw the list of those. There are no annual or lifetime limits on those coverages. So anything, if you have emergency treatment, so you had a major car wreck and you have emergency treatment and you blow through what would have been a limit that was on your coverage previously, there is no such thing as a limit on emergency treatment anymore. There's no such thing as a limit on lab services anymore because it's considered a minimum essential benefit. So you can't have annual limits on it or lifetime limits on those, okay? So that coverage will always be there. You can't run out on that coverage. And then the last thing for premiums, the only things they can rate your premiums on, so they used to be able to rate on pre-existing, they can't do that anymore, meaning how they price you. It's based on age, so the older you are charged more, but it's capped. You can't be charged exorbitantly more. You can be charged 3 times. The oldest person in the plan can be charged 3 times what the youngest person in the plan is. So if you've got a 22-year-old who's being charged $200 a month, a 64-year-old who's right before they get on Medicare will be charged $600. That's the max they can be. Max difference is a 3-to-1 ratio. The other things they rate on are based on household size, which makes sense. The bigger your household is, the more people you're covering, they're going to charge you more. Makes sense. The other things include tobacco use. You can be charged 150% of what if you're a non-smoker, you're going to pay $100. This example, you would pay a $100 premium. If you were a smoker, you would be charged a $150 premium because you use tobacco. And the other thing that they rate on is based on geographic area. So everybody in Whitfield County, assuming if you had the same age, same household size, and same tobacco use, if you didn't use tobacco, you would be charged the same thing because you're all in Whitfield County. So it's based on a geographic area, and they're based on county clusters. So there are some counties that are together. It's not really a region. They don't make a whole lot as far as like, you know, breaking off different pieces. You're not really going to figure out what counties go together without knowing it. But Whitfield it's bigger than counties, so it's like a few counties at a time are rating areas. Let's see. We also talked about the metal tiers on the health insurance marketplace. So we looked at the catastrophic ones. That is only for individuals who are under the age of 30. They're the ones who can get that less than 60% of their total costs covered because it's catastrophic for them. They get 3 office visits a year, and then after that, it's a pretty high deductible. It's a high deductible plan, and it's the only high deductible plan offered on the marketplace. And so that is for young individuals who want to pay very low premiums and are pretty healthy, and so if they needed their insurance, it would be for a catastrophe. Then you've got bronze that pays for about 60% of your medical costs. Silver is 70, gold is 80, platinum is 90. And those things, as you go up, your premiums are going up with each of those plans, but your out-of-pocket costs, so your deductibles, your co-pays, your co-insurance, those are all going down. So are you paying before or are you paying after your service is based, or at the time of your service? So either way you're paying, you're just deciding which way. And so people that are more healthy, less likely to use their insurance are going to probably be on those lower premium sides. But those people who do have a pre-existing condition, need more medical care, or want to have that more coverage, will end up paying those higher premiums so that they have that extended coverage. They have more coverage, and they're not hit with more bills in the end than they thought they would be. We talked about the premium tax credits and what the income limits were on those. There's another program in there that if you make less than 250% of the federal poverty guidelines, you can get cost sharing reductions, which reduces those out-of-pocket costs for deductibles, co-pays, co-insurance. That's for those, so if we're talking about an individual, that's someone making between about $11,500 and about $28,700. Someone in that gap, or that area, or range, would be eligible for those cost-sharing reductions. So that brings down, so you have to choose a silver plan to get that, one that pays about 70% of your costs. But I was with a gentleman the other day when we did an enrollment appointment, and the actuarial value, that 60, 70, or 80% on a silver plan was actually 87% for this person because of those reduced deductibles, co-pays. So it was almost close to a platinum plan. It was better. It ended up being a better deal for him than a gold plan because he had those cost-sharing reductions built in. So that's something else to be aware of. If you're in that, it's a smaller bracket, but there is that available to people as well. Let's see. I think that's pretty much all I was going to cover and just refresh on before I start playing this video. This video is from the marketplace, so it's from healthcare.gov, and it walks you through how you access the marketplace. So you go to healthcare.gov, that's the first place you start. If you're doing it online, which is the way that they prefer you do it, it will be faster processing time. But you go to healthcare.gov, click apply now, tell them what state you're in, and then you're off to go. So that's what this video will be. Yeah.
One quick question. Now, this is all done annually, right? You can't buy a policy for 10 years under this.
So it's done annually as far as picking a policy. You can have the marketplace verify your data for you every year for 5 years. So you can do that for up to 5 years, to where you don't have to resubmit an application. You just have to re-enroll in plans each year. So.
So does that mean in 5 years it goes up, you have to do it again?
Yeah, you'd have to submit another application to re-verify your identity and things like that.
How long after you fill out the application do you get a response?
So when you hit enroll, you are taken to that.
I've already did it weeks ago.
And you've already hit enroll and you have not heard from your insurance company either? Okay. So that's something, I haven't had many people who've gotten all the way through the enrollment because of website issues. And so that's something that, have you called your insurance company and talked?
I don't have insurance. I'm trying to get insurance.
Okay, so you've submitted your application, but you haven't clicked enroll in insurance. Have you looked at insurance plans and hit enroll in one yet, or no?
No.
Okay, so you should have received your eligibility notice pretty much immediately. And so I can help you, if we want to log into your account at some point, we can see where it is. You should be able to have that immediately. If you do it online, it should come back immediately. If you do it paper, it's going to take 3 to 4 to 5 weeks of processing before they send it back to you. So mail is going to be snail mail, literally. It'll take longer if you do it that way. Over the phone should be pretty much immediate as well, because they're entering it in online as they talk to you. So,
Alex?
yes.
Excuse me a minute. You said over the phone it would be pretty much immediate?
You should receive your eligibility notice, yeah.
Okay, because that's not what I was told today when I spoke.
What did they say?
I've been hung up in a loop since the beginning of October.
Okay.
So she offered to take my application online instead. And I asked her how long it would take to receive my eligibility notice. And she said, the only thing we can promise you is you'll receive it before the end of the enrollment year.
Okay, interesting, because they've been telling us that it would be the same as entering it online, it's just somebody else doing it for you.
And she
So,
said, and I told her that I had already received, before I got hung up, the amount of my subsidy online. And she said, well, that, you can't depend on that, it may not be right. We've got to start over. So,
interesting, okay. That's not anything that we've been told as navigators at this
that's what I was
point,
told.
so.
That's what I was told this morning.
Okay, interesting. So that may be, it may not be as immediate as we were told, so, yes.
I did an application by phone a month ago.
And you still haven't received an
not heard
eligibility
anything.
notice? Interesting.
Well, one of the stories that they say on the news, so you can take that with a grain of salt if you want to. They're saying that if you do it online or if you do it by mail, it still has to be entered into the computers. It's the same computers that are hung up that you can't get on through home computer. So, as it stands now, until they fix some of the problems with the website, you're probably not going to get anything.
Now that's what they've told us about the paper applications, is that those would be entered in online, and that's why it's taking so long to process paper applications. I've not heard that about phone.
Now,
but
like I said,
no.
that's NBC News. I'll tell you who said it.
Alex, you know, you hear all this news on TV about the slow computers at Obamacare. Anybody in here that's been on Medicare can tell you, we're used to waiting. And I'll tell you why. I went in to change my prescription around the first week in October. And I wanted to add prescriptions. I had the confirmation, well, it was a 25-minute wait, 50 minutes on the phone with her. She gave me a confirmation number, and she said it would be effective November 1st. November came, November 1st went. So I called back. They had no history of my confirmation number. So I went through it again, and so today I received my packet. 2 packets, in fact. So I think it's the government's computer system, period, that is slow, including Medicare's computers.
Yeah, and that's something that's separate than the health insurance marketplace, so you're right. I mean, it is.
It's not just Obamacare, it's Medicare that's slow.
And especially with this rollout, it's been pretty tumultuous, I guess is the best way to say, as far as the website has gone and the way that filing applications has been. It's been pretty difficult. I'll tell you, as a navigator, I don't have any special inroads into the website. I wish I did, and I have a lot of conversations with people that really want me to be able to do more for them in getting them through that website, but that's not anything I can do. It's hit or miss. I've had pretty good hits most of the time, but I have had people come in my office, we sit down and do an enrollment, we get to the account, they create an account, and then they can't go any further. The system is down. And so it is hit or miss sometimes, so you just have to be patient with doing it. And so a lot of people opt to file a paper application. It's not necessarily going to be any quicker because they are doing that paper processing that takes a little while. So it is what it is at this point as far as how it is to submit an application. But I will do my best to help you get it in the way that I can do so. showing you, it's supposed to have sound. Let's see. So this is walking you through creating a marketplace account.
I'm gonna kill these lights.
Okay, that's fine.
Be able to see that better.
So this is the initial part of creating an account. So you have to have an email address to complete an account online, but it gives you an option for creating one as well. You have a username and password similar to what you would have with any other online website. You also have to complete security questions so that if you ever lock yourself out of your account, you can log back in. Because they will ask you these questions, so you have to be able to know what the things you wrote down are. You have to know what you said. So it sends an email to your email address. You have to click on it to verify your email address, and then you can log in, and then you begin applying for coverage. So when you log in, you will need social security numbers for anyone in your household. Household income information is the other thing. You're projecting your 2014 income. So it's not about what you made in the most recent year, it's about what you think you're going to make next year. Then it goes through and verifies all of your contact information. So if anyone helps you complete it, so if I sat down and helped you, I would click that Navigator button and enter my information in. And then it asks if you're applying for coverage just for yourself and other people, or for other people. So an adult can apply for coverage for their spouse, on behalf of their spouse or on behalf of their children. If they have coverage through their job and their dependents aren't covered, they can look for insurance on the marketplace.
Alex,
Yes.
what happens, you said you project your 2014 income.
Uh-huh.
What happens if you project your 2014 income and then it turns out to be that you don't make enough to qualify for a subsidy? You know, say you need to make
At least 11,500.
yeah, or family of two, you need to make 12,000 something, and you don't make that much, then what happens then?
I have not actually had that question before. I don't know the answer to that. I know the answer if you're still within the range of getting subsidies, what will happen. And so if you say you said you're going to make $20,000, you end up making more than that. You make $25,000. You are eligible for less dollars worth of subsidy every month, and they'll take that out, basically have a tax penalty at the end of the year where you pay that back to them on your taxes.
Yeah, Alex, I actually looked into that. If you during the year, say in 2014, if you realize your income's changing, you can go on and actually change it mid-year. You can do it as many times as you want.
But if it's going down and you're gonna be...
At the end of the year, when you file your tax return, you're gonna have, if you've changed your subsidy levels, you'll have to pay it back. And
You'll have to pay it back?
On your income. The subsidy is actually technically calculated at the end of the year. This is really sort of an estimate.
Yeah.
So the risk is that if you underestimate your income, you're going to have to pay back the government.
What I'm talking about, if you overestimate your income.
Yeah.
That's my
The reverse is also true. If you don't get a subsidy at all and you're actually able to get one, you'll get it.
So you would get more credit, but I don't know what happens if you fall into that coverage gap. Do you know?
You'll just get it when you file your tax return.
Yeah, but you wouldn't get that credit because you're not eligible for those credits because you're not in the 100 to 400%. You see what she's saying? If you fall out of subsidy range.
Right, but when you file your tax return, you'll take that income tax deduction. So that's what
Okay.
Are you following?
Yeah.
So in other words, you'll get it, and well, unless you're not due. I mean, the only time, unless you weren't going to file a tax return or something like that, but I can't see that happening.
My son falls in that gap where he's not eligible for Medicaid, but he doesn't make enough to qualify for a subsidy.
Yeah.
But there's a possibility he might next year.
Yeah.
But if he applies and assumes that he's gonna make enough to qualify for a subsidy, what's going to happen when it's time for him to file taxes at the end of the year, if he didn't make enough, if he only made, enough, you know,
Yeah.
he still didn't make little enough for Medicare, but he didn't make enough to qualify for that subsidy, but he had that subsidy. Is he gonna have to go back and pay those
Yes.
premiums?
He's gonna have to go back and pay the benefit of the subsidies. The difference in what subsidy he got and the difference.
Because the subsidy would be almost, in his case, would be almost probably the total amount of the premium. So you're talking about, maybe several $1,000s. That's just fantastic.
Well, look, I mean.
It's better, doesn't it?
The bottom line is, during the year, he can update this and hopefully account for that. So if I'm employed and I get fired mid-year, I can go on here and tell it my income stream. And then your subsidies will be accounted for.
His problem is he works part-time and he doesn't know from
He
one
won't
week to
know.
the next how many hours he's gonna
Better
make.
to overestimate.
Just do without insurance like he's having to do now.
Well, maybe.
That's just bad. Hey, Mom, let's go home. I'm tired of this. I'm fed up.
See, I'm on disability, I don't file taxes, I do
Okay.
it just because they have to.
Right,
So I
sure.
can't write none of that off or estimate anything yet.
So you have a fixed income, Social Security is included as a type of income underneath this, so you would qualify for, depending on what your fixed income is, you would be able to apply for subsidies, and then you just file your taxes at the end of the year, and it wouldn't be a difficult thing because you have one line that you would include, so. Because that way you're able to reconcile your credits, because you can, so to his point, you can take partial credit. So you don't have to take the full amount of credit that's offered to you. So if you're offered $470 worth of subsidy credit, you can apply $400 of it towards your subsidy, towards your premium each month if you have a variable income. So I talked to a lot of people who are farmers or who work in restaurants or have weekly jobs. They don't really know how much their income is going to be. They're not on a fixed income. And so they can take a part of that to cushion in case their income does go up. They then are not hit with a tax penalty because they were not eligible for as many dollars as they received. They have that cushion there as well. So that's something. You don't have to take the full amount of your credit. You can actually take no credit if you're, eligible for $470. You can say, I don't want any of this. Give it all back to me at the end of the year as a tax credit, and then that can offset any other taxes you pay. So that's also an option as well. You can set your level of credit that you want to take, your premium tax credit.
Well, one other thing too. You're able to adjust the amount of deductible.
Yes. If
So-
you're on that cost sharing reduction, if
Yeah.
you're within that 100.
You can roll that one way or another in order to get within a subsidy. In other words, you can have $1,000 deductible as opposed to $1 deductible.
So this is just still taking you through all of the application. The people that have gone through it and it worked pretty rapidly took about 45 minutes to do it. And because it asks you about other health coverage, it asks you income, and it asks you demographic information about your family. So it asks several things, and you're close to the end of signing the application. And so then once you submit the application, you'll get back an eligibility notice.
Hannah, hello, please come to the front office. Hannah, front office.
Somewhere on there has a timetable chart of you're eligible or not. It has your money on that at the end of the year and stuff like that. But I fall way under what it says. Should be eligible for it.
You would think so. It depends on what it is. If it's below 11,000, or it depends on your household size, and then also if you're applying as what your fixed income is. So if you're applying as an individual and you're less than 11,509 or 490, then you're likely to not be eligible for a subsidy because you fall below that. But if you're above that, then you would be likely be eligible for a subsidy. So this is just reviewing everything that you've entered in. It asks you many times your information and wants to make sure you are who you say you are when you apply for insurance.
Dr. Calloway told me something interesting. He is for this affordable care plan. He said, but who do you think is the first president that came up with an idea for affordable health care? And I said, Hillary. He said, no, President Truman. Now, if we had been able to get our congressmen to work back in that day through now, we wouldn't have to be going through all this. We'd be far more advanced, and the computers would be ahead of time.
It's just like Social Security. Eventually it'll be accepted and we'll wonder how we got by without it.
Yeah.
But it's painful to change. And people are so
It's not painful
anxious.
to change, it's painful to me that I have to pay for people that is just as able to get out here and work like I do, and they just choose not to. That's
Well,
what
this way
ticks me
This
off.
way they're covered. But see, you got people
Exactly,
that
I'm gonna pay for that.
they're willing, there's people out there willing to pay $100 plus for a cell phone plan when we didn't have cell phones.
Well, I don't
15
pay
years
for
ago.
cell phone, they'll probably.
This is much better use of money, so it's just something we have to get used to.
Well, we're paying for other people's medical right now.
Yeah, we are.
Until they go to.
They go to the hospital and they don't pay their bill.
And I know somebody just died, but had heart surgery, and didn't have any health care, so guess who pays?
Yeah, we do.
The ER or health department, we pay anyway.
We pay in higher expenses when we go to the hospital. That's why everything costs a daggone much.
I think they said on television that when Social Security went in, nobody benefited for 7 years because it took that long to get it into there.
So this is where it's talking about how you can set your premium tax credit. In this slide before this, it showed where you would get your eligibility notice.
So you find out your subsidy in your eligibility letter?
Yes, that's where it is. So if you're eligible, it will tell you that in that eligibility confirmation notice.
Except my eligibility letter was blank everywhere. It was supposed to have my information.
Oh, well, that's unfortunate.
I think she's got it warmed up.
So this is, again, how you go through the enrollment. This is showing you, this is about to show plans of what they look like. It explains to you the tiered system. It shows you what you're looking at in terms of things. When you get to this point and you have a subsidy and you've elected to take it, it will show you premiums based on what you set that subsidy level at. So it will show you the reduced premiums here. You won't see the full bill price here. Because what happens with those subsidies, the government sends that directly to the health insurance agency. It does not come to you. It goes directly to the health insurance agency, and it is a discount on your premiums. So, and then it shows you all the things that are covered under there, including prescription drugs, what you would have to pay for each thing. You can see a provider directory. So if it's really important to you that your child sees Dr. White, make sure it's on there. So those are other pieces that it shows you what's available in terms of coverage. So this is what the interface, this is what it looks like when you're in there. And you can compare them side by side so you can see exactly the differences in each plan. You can compare up to 3 at a time. Here in Whitfield County, there are 2 different insurance companies. There's Alliant and Blue Cross Blue Shield who are offering insurance plans. And I think there's about, don't quote me on this, but I think it's about 21 plans that they have. Those range from catastrophic all the way up to gold, I believe. I don't think there are any platinum plans.
You know, in a way, it's sort of exciting to see. I'm 72, but it's sort of exciting to see this change go through. I've lived through so many changes during my lifetime. World War II, and then desegregation, and we've seen our nation advance in that way.
And this is where it'll take you to the next website. So when you hit that pay for health plan, it will take you to the health insurance agency's website. So this is just saying that it's a training demonstration. It's no real information. But that's basically what it looks like when you go through.
Let that be light.
Does anyone have any other questions while I'm here? Like I said, I'll be here at the community center from about noon to 5 every Thursday afternoon. Other than Thanksgiving, of course, some people want to do your insurance on Thanksgiving, I absolutely don't. Otherwise, feel free to call me, you've got my number.
I got to go to the bathroom. You didn't hear what I said?
Okay.
I'll come back and get you.
So you never